Hello everyone. Today we are going to talk about headache because in the subsequent video we are going to be discussing about the history taking of headache. That is how you can approach a patient with headache actually. So this will actually set up our mind in knowing and understanding the diseases that may lead to headache. So so as to ease the understanding of the subsequent video of history taken about headache. So let us begin actually. So what is headache? Actually, headache can be defined as a kind of unpleasant sensation in the head. Sometimes it may originate from the head itself, or it may originate from the neck and then radiating to the neck or to the head, or originate from the face and then radiating to the head. And all these broad categories actually, it may lead to kind of unpleasant sensation in the head actually. So which is termed as the headache, which is painful actually, depending on the severity. So we have two types of headache actually. We have number one, we have primary headache. Number two, we have secondary headache. Secondary headache. So when we say primary headache, it means the head is pain. There is pain in the head, but without any underlying pathology. So without any obvious underlying pathology. While in a secondary headache, actually, the headache it is caused by an underlying pathology, not necessarily in the head. For example, when we say someone is having a kind of malaria it is not actually originating from the head. It can affect the head, but it is not originating from the head in most of the patient. So, but due to that fever and that malaria, we can have a kind of headache, right? So that's why we can term it as the primary as the secondary headache because it is due to an underlying pathology. So that is it. So now, as an example of primary headache, we have migraine headache, we have cluster, we have sinus headache, and then we have tension headache. Tension like this. So that is it. That is a primary headache. So when we are going to discuss about this type of headache, actually the migraine, cluster, sinus, and then the tension. But I will definitely upload a kind of separate video about migraine because it's very very important. It's very very vital. So in that video, we will actually going to discuss a great detail about the migraine. So migraine headache. So in the migraine headache, what causes the migraine actually is a kind of, and it is idiopathic. We don't know the cause. Idiopathic headache. We don't know the underlying cause of the migraine headache. So what about the symptoms and the site? Mostly let us see the diagram actually. This is the migraine headache. It actually affects the lateral side of the head, that is one side. See from top to bottom. This is from the top to the jaw. That is this demarcated area. So this is the area which is affected by this migraine. So the patient will actually be complaining of unilateral headache actually, and this kind of migraine headache, the patient develop a kind of aura. There is kind of aura which is called a prodromal symptom before he or she experience this kind of headache actually. We have aura. This aura means a prodromal symptoms. The patient will actually experience a kind of symptoms, some specific symptoms. For example, some minutes before he developed this kind of unilateral headache. This is called. These symptoms are called aura, and they include a kind of light flashes. Light flashes. Most of the patients develop a kind of light flashes in their eyes. They mostly see a kind of light flashes in their eyes before they experience this kind of headache. The moment they experience these light flashes, they themselves know that they are going to develop this headache in a minute after. So this is called the aura, which is called the prodromal symptoms actually. For example, before someone develop vomiting, mostly he has to develop nausea, right? So as this migraine also, before they develop the unilateral headache, then they develop this aura actually. So, and the side is kind of unilateral, right? As we have saw it in the previous picture, lateral side, unilateral headache. That is it. And then the pen, that is the characteristic of the pen, is kind of throbbing in nature. Very, very throbbing and then and pulsating. The moment in a case file you see throbbing and pulsating, just be thinking about this migraine. It's not necessary to be migraine, but mostly it is migraine that causes this pulsating, especially this pulsating throbbing. So that is it in nature. So that is it. And then it is associated with nausea and vomiting. Associated with nausea and vomiting. So that is it. So this the unilateral headache, throbbing and pulsating in nature, then associated with nausea and vomiting. So what makes it to be worse is it is worse by movement. It is worsened by movement. By movement. And alleviated or relieved by lying down, by sleeping or lying down or whatsoever. That's resting. So that is it. So this is the migraine. We have separate video about migraine, the treatment, the prevention, then the complication of the migraine actually. And sometimes the migraine may develop a kind of complication like hemiparalysis or whatsoever. So that one we will see in a minute. This video is meant to actually ease our history taken about headache. So the second category of primary headache, we have cluster headache. Cluster type. When we say cluster type, we have to see the picture. This is a kind of the cluster headache. This is it. This is where it originates. It mostly originates from around the eye, not from inside the eye, but around the eye. Actually, the pain originates from this area around the eye, and then radiate to the head. Actually, so that is it. And then this cluster headache, actually, the causative agent is also not exactly known, but it is associated with a kind of risk factors. Risk factors like alcohol intake, alcoholism, taking nitroglycerin, the drug that is used in angina pectoris, and there's a esophageal spasm. So this actually tobacco smoking also is associated with cluster headache. So these are the risk factors that may lead someone to be having this kind of cluster headache. And it is termed as cluster because it is kind of, the attack is coming in a regular fashion actually. For example, let's say after every some certain days, after every certain, so after kind of, for example, let's say 1 week, he will develop this, or after 3 days, he will develop this kind of cluster headache. This is actually occur in a kind of regular fashion actually. So that is it. And then when we are talking about the symptoms, symptoms of the headache, actually it is developing around the eye, that is ocular, around the eye, around the eye. Number two, the pain is a kind of actually associated with a kind of nasal discharge, watering of the eye, watering of the eye. That is tear. That is increasing in production of tear, watering of the eye. That is it. And then drooping of eyelid. And don't forget that it is unilateral. It is affecting one eye. Drooping of eyelid. And then constriction of pupil. That is miosis. Constriction of the pupil. So this is the actually symptoms of this cluster headache. And then together with the headache, the around the head is developing around the head, the eye, and then affecting the head. That is it. That is especially the side of the affected eye. If it is the right eye that is having the pain, then actually there is mostly the pain of the head will be originating also in the right side of the head actually. So that is it. And then we are going to look about the third category, which is sinus headache. This sinus headache actually originates from the sinuses. We have maxillary sinuses, we have ethmoidal sinuses, we have frontal sinuses, right? So this is the headache actually. So this is the sinus headache. You see, pain behind the brow bone and then cheekbones. Because here we are having the maxillary sinuses. Here we have the frontal sinuses here. So this in the frontal sinuses. So this is the sinuses. So the location at which the patient is going to be showing you as a doctor, he will be pointing this particular area actually, and then together with the head pain actually. So that is it. So that is pain around the sinus, and mostly the patient will be thinking about, and the patient and the doctor will be thinking about the pain is due to sinusitis, but mostly it is not due to the sinusitis actually. The sinusitis also can lead to the same kind of pain around the side, but it is not due to sinusitis because most of the patients that has this sinus headache are even at long last they are diagnosed with migraine headache. So that is it. The pain is around the sinus, around the area where there is sinuses like cheekbone, because the cheekbone we have in the sinuses and the front of the head also, and front of the head, because in the front of the head we have also another side sinus called frontal sinus. So that is it. Then we have tension headache. From the tension, if someone is in tension, for example stress, due to stress, that is etiology. The cause, it is due to stress. For example, lack of sleeping, or someone who is undergoing a kind of pressure, maybe at work. Maybe, for example, is a kind of his work, for example, start from morning since even and lasting up to evening, 12 hours. For example, let's say surgeons, because surgeons, they are at high risk of developing this tension headache because of their how stressful their work is. So and so on and so forth. Uh, Actually, hunger is also a kind of stress, right? Hunger can also lead to stress actually. So and so on and so forth. So that one can lead to a kind of distension headache. And then the side at which the head originates is actually from the frontal in origin. That is front of the head. And then it is characterized by kind of sensation of pressure and tightness in the head. Pressure and tightness of the head. He will describe it as pressure and tightness sensation of the head. So that is, and then mostly in the frontal area. This is it. This is it. So that is this tension, squeezing sometimes. So that is it. So now we are going to actually go and talk about the secondary causes of headache, because as we have listed before, we have primary and then we have secondary. So the aforementioned headache are actually kind of primary headache, not the secondary. Now we are going to talk about the secondary headache actually. So the secondary type of headache.